Now, in our daily practice, if we assess that we do in fact have superficial fascial dysfunction, for example, if we just palpate and just take the whole myofascial structures and just move it between thumb and fingers, we get a sense of, does that whole myofascial system move fluidly and elegantly and compliantly, or is there some areas within that fascia that seem to be excessively dense? Lack of pliability as we're doing that motion. So let's introduce the idea of using some cupping. So we might be familiar with the rigid cupping, but we want to introduce you to this tool, which is the flexible silicone cup. And why we think this is such a useful clinical tool is that it's just so easy to interchange between using our fingers and then popping the cup on like so, and we can continue to work. Something that can be taken off and we can continue to work. It's such an easy tool for us to interchange with our fingers. So that's one of the first things that we want to be talking about. So we will first of all need to have a seal between the cup and the skin. So we're using jojoba wax here. You could use any of your preferred creams or oils, but particularly an oil because we want gliding of the tissue a little bit later. So an oil is a much nicer product. Now, first of all, it's thinking about, now how do we place the cup on the body and how do we get it off? That's the most important thing to first of all master, if you like. So making sure that we always suggest that we stay away from bony prominences. So we wouldn't just plonk it here, for example. Here's our medial border of our scapula and here's our spinous processes. We wouldn't suggest that we just put it there because we're getting over the bony edge of the medial border and the bony points of the spinous processes of the spine. So let's start in this region here, a lovely open area. It's a good size that we're using here. We've got almost a lovely match between us working on the longissimus and iliocostalis myofascia. So all we're going to do is just compress the cup like so and place that on the body, and then as we release it creates negative pressure and it's drawing the tissue up in that familiar way that the cupping does work. So that's our starting point. And how will we release that? Well, all we got to do really is just to create a void between the skin and the cup like so, and it releases that straight away. So we could do the same thing as well. You could just basically pull it off, and it wouldn't be very, very professional to do something like that. Much nicer just to create an easy break in the seal to remove that. So now, why is this so useful? We could be doing some work. Let's just try on this right side, for example. We're starting to do some work and we feel that there is some fascial density at that point there. How easy is it for us to apply the cup there like so, and we're still applying a therapeutic tool, but one is taking some pressure off our hands, but still doing something very, very useful. And it just also, we could even be working superior to that or inferior to that. We can just leave that cup there as in static place. Now, if we are using it and leaving it in a static position, we suggest that we don't create excessive bruising of the body. And as you can be very, very aware, that cupping can in fact create excessive bruising. Now, we're not saying that's a good or a bad thing, but we're just saying if we do not want to create excessive bruising, there's ways of reducing that. And the way is to, when we have the cup in situ like so, if you wouldn't mind just looking at the colour of the tissue at all times. And if it stays a nice pinky colour, then all is good. But once that colour starts to go from a pinky colour into a more deeper rose colour, in our experience, that's the transition period where if we leave it on, we can actually start to create a bruise there. But if we take that off at any stage, that area of pinkiness will dissipate very, very quickly. So that's all we're saying. And a lot of my work has been working with doctors and physiotherapists, and and they might not understand the concepts of using cupping. And if my patient goes from myself to see a doctor or a physio a few days later, and there's these marks there, we're just creating an unnecessary, potential barrier between, what we're doing as a therapist and what the physio or doctor is interpreting that we're doing. And also too, when you're using your hands on a day-to-day basis, whether we're using gliding, whether we're using frictional movements, whether we're using digital pressure, do we expect to bruise the body? No, we don't. So therefore, any tool that we select to use as well, we think shouldn't be any different. If we don't create bruising with our fingers, then the tools that we use shouldn't create bruising either. Alrighty, so first of all, then we've got this idea of the static position like so. That's lovely. So as we said, we can be working around that. We can be working the other side. We can be doing some mobilization, for example, and just looking over here. And as soon as that color starts to become a little bit more rose colored, then we can just move it, for example, to a new place and then continue the work. That's great. Still keeping an eye on what's happening. We could easily then move that down to another place like so and continue the work. But we still want to be anatomically specific. We don't want to be doing this. We see some people using these things and they're just all over the shop and it's just all over here like so. We're not advocating that sort of work. We're advocating you've selected a particular area to change and to treat, to make something more positive. So let's stick with that area with your cup. And by all means, if you want it to work, for example, the lat dorsi, then great. That's perfectly okay. But stick to the areas that you want to be working at in a systematic way rather than an ad hoc manner. Lovely. So there's our static position. But of course, we can always have the cup and we can move it through a long distance or a longer distance. And up we go into just using this as a sliding cupping rather than just as a static cup. And you can just see it's dragging that little bit. Now that's two things. It could even be excessive negative pressure in the cup, or we just haven't quite got enough wax on our skin. So we could take that off, for example. We could just pop a little bit more of our wax there like so. And then we could pop that back on again and away we go. That's much nicer. Now, the great thing about these flexible cups is that, in fact, we do want to move between the medial border of the scapula and our spinous processes. And we said we don't want to just keep working in and going over these bony prominences. It's one of the rules that we would like to put in place. And when we're using cupping, that we don't cup over bony prominences, because it could, in certain instances, create some dysfunction there. We've certainly seen in our many years of clinical practice where somebody's been too aggressive with cupping and they've in fact pulled a little bit of the myofascia away from the periosteal attachment there, which is it's not a particularly nice thing for us to be doing. So we want to avoid that. So what we can do with the cup is that when it comes to this point here, because it's so flexible, we can simply just squeeze it like so and still work in that same space, but without touching, if you like, the bony prominences. So we can work in a tiny space like so, and we're still doing what we want to be doing therapeutically, but we're not putting excessive force over those bony prominences. So there we go. So as we can see, that we could take that off very, very easily, continue the work that we're doing with our fingers, with our thumbs, whatever we think is appropriate. But it's just so easy to think, oh, I'd like to do a little bit more there, but I've got more to do elsewhere. So I'll pop the cup back there again, and I will continue my work wherever it might be up the body. So you can see it's taking some stress off our hands. It's actually giving you more therapeutic action, if you like, on the body, simultaneously to what we're doing with our hands. There's something else happening as well, which gives our patient, if you like, more value for the time they spend with us.